In this month's Health Check, we're talking with WVU Medicine Camden Clark family medicine physician Dr. Daniel Schenk about why primary care is a cornerstone of good health, from annual checkups and preventative screenings to daily habits that you keep feeling your best. Dr. Schenk, thank you so much for sitting down with us.
Thank you. I'm excited about it. Looking forward to it.
Absolutely. So the first thing I want to ask you is, can you tell us a little bit about the basics with what you do in family medicine?
Yeah, so family medicine is really kind of like the front line of a patient's health, right? Mm-hmm. So we have to know everything about everything, essentially.
Yeah.
Right? So it's really kind of knowing the patient's goals, mm-hmm. What they want for their health, essentially. We have our ideas,
right.
Numbers, what things need to be, but really it's important to know what a patient wants and kind of tailor everything to more of their lifestyle, their goals, and really just kind of help coordinate. If a surgeon wants to do surgery, mm-hmm. is that a good decision for them? What would their other options be? Those kinds of things.
Right. And so as a family doctor, obviously a lot of people come to you when they're sick, but obviously you want people to come see you for those annual checkups, those physicals, the routine checkups that we talk about. So can you just talk about why those things are so important for people to come in, even if they aren't, feeling their best?
Yeah, absolutely. So I would say it's much more effective to try to prevent disease mm-hmm. than treat it once it's there, right? So once you start to have symptoms, once a diagnosis is already made, now that sends off a whole other cascade of testing, of treatment, medications, those things. Whereas if we're following things through pretty regularly, mm-hmm. yearly basis, every 6 months, something like that, then a lot of times we can make changes, find those silent problems before mm-hmm. they actually come about. And try to do as much as we can through lifestyle, specifically, ideally. Mm-hmm. But depending on the severity and kind of when we find these things going on, medications or other type of intervention if we need to.
Right.
Go ahead, man.
And so can you tell us some of the key screenings and blood tests that, people, especially adults, should be looking out for and, getting taken regularly?
Absolutely. So we definitely recommend the age-related cancer screenings. Mm-hmm. Now, these aren't always the most exciting or comfortable tests to have done, but they are very crucial in trying to detect that disease very early on. Mm-hmm. Okay, very early, where we can have minimal medical intervention, if any at all sometimes, they just monitor.
Absolutely, and early detection is super critical.
Absolutely. So, those we definitely encourage, mm-hmm. But also some of the more common labs to evaluate if your immune system's functioning right, hemoglobin in terms of carrying oxygen around, mm-hmm. renal function, cholesterol panels, and A1C, blood sugar testing too.
Right, and so you mentioned blood sugar, and it was a word you used earlier, numbers. A thing that a lot of doctors talk about is knowing your numbers. What are some of those numbers that people should be testing for, and why is it important to know those kinds of numbers for your overall health?
Yeah, so everyone should know their whole cholesterol panel. Mm-hmm. A lot of times they like to mention the total cholesterol number or whatever, but you really need to know the whole panel, right? So your LDL is very important, that bad cholesterol we talk about mm-hmm. in terms of risk and things, but especially within that, your triglycerides, your HDL, that good cholesterol, all these things are very important just in that one panel. And then certainly knowing blood sugar mm-hmm. levels, even A1C, pre-diabetic range, or even if you're lower than that, maybe even looking into fasting insulin levels, which can kind of give some hint into developing insulin resistance, metabolic issues before we get to those diagnoses, right?
Yeah.
Now, the other things I would say that may not be as common would be liver enzymes, right? So liver mm-hmm. enzymes are one of those things that are kind of increasing more frequently with people, and fatty liver, kind of the most common cause of that, is now the number one cause of cirrhosis. So a lot of times people think, alcohol, cirrhosis, I don't have to worry about that. But fatty liver is becoming one of those things, and you can help give us that bigger picture into your overall metabolic health as well.
And so I want to turn our attention to preventative care. It's evolved a lot over the years. Can you just talk about some of the new tools and trends that go on within your field for this type of stuff?
Yeah, so there's a lot of rapidly evolving technology mm-hmm. in the form of like wearables, where it gives people, they come and see us, we tell them kind of a picture of their health is there, but they can have these wearables on, see how their body responds to exercise, their sleep quality, mm-hmm. not just, I felt great this morning, but then the next I needed 2 cups of coffee, right? So they can kind of track that and be a little more involved with their health, help to be a little more proactive with their health and, and measure those changes. But a couple other things I think are pretty cool is kind of genetic testing and being more personalized to the patient, right? What your genetics say you should be eating, how you should be exercising, can, I think, be a thing that's coming into play.
And I'm sure that's truly evolved a lot from what it was maybe 50 years ago to
absolutely.
the genetic testing you can do now.
Yep. Instead of just kind of guessing around, doing elimination diets and hoping for the best, you just kind of test it, see what your body's wanting, reacting to, and then tailor things pretty easily from there. And then even in the form of like early cancer detection, we talked about the importance of these screenings that we have in forms of colonoscopies, mammograms, but there's even some testing out there where it's a blood draw that detects over 50 cancer markers within the blood. So things we typically don't screen for in terms of pancreatic cancer, testicular cancer, and these kinds of things can be detected on something like that. And that's kind of going through studies and seeing how effective it can be in true screening role.
Right. And so, Dr. Shank, before I let you go here, one final question. For those out there that are watching tonight that haven't gone for their annual checkup in a long time, what would be your message to them for the help of prevention, for their health, getting any diseases, any illnesses, how going to get these annual checkups helps them and why it's important to continue to go?
Absolutely. So I would say it's never too late to get started, right? You can always call in, get set up for an appointment, because all these prevention techniques can really add years to your life.
Right.
But a lot of the information and discussion we have during these annual visits can help to add life to those years. So I think it's very important. It's certainly investment in your health for the long term that you're able to get started today.
Absolutely. Well, Dr. Shank, thank you so much for sharing so much knowledge with us and a lot of great information on this topic. We'll have you again back next week, and we're going to continue our conversation about family health and family medicine. Thank you so much.
Thank you for having me.
Of course. When we return Mid-Ohio Valley, Jason will have one last look at your forecast. Stay with us.